reason that we put this class together this way, I have 2 arthritis classes, understanding arthritis, and then treatment options for arthritis are on the YouTube page already. So if you haven't already done it, you can go to the YouTube page and you just type in YouTube, you type in the search bar, Rosemont Chiropractic, and you'll see our name pop up before you get too far in. And if you like the page, because if you don't like the page, you're going to see some of my videos and some of other people's videos, and then some of my videos and some of other people's videos. But if you like the page, then it'll just take you to just our videos, and you can just peruse through that and then just pick out and look at what you might want to watch. But the arthritis classes are there. They're done pretty well. Put a lot of work into those, and I've been doing those classes for a lot of years. So when we have the discussion about osteoarthritis versus osteoporosis tonight, I'm going to spend just a little bit more time on osteoporosis because that class is enough. And I do have a whole class just dedicated to that, but I wanted to touch base with it in this format because people ask me a lot of questions about osteoporosis and osteoarthritis, and sometimes they don't know what the difference is, and sometimes they think certain things about the 2 things that just are not true. And ultimately, to be a good doctor of Latin, from way back into Latin, understanding of what doctor was, it was really to teach. And so physician was to teach. And so we've really gotten away from that, hugely. And the way we go to a doctor and we get handed a prescription and we walk out the door with very little education about what our conditions are. Maybe we get a pamphlet, from the doctor or something like that. Here, just read this. But they're really, truly the education of what to do or how to prevent, or is there something you can do to help your body heal so you're not having to take those medications for the rest of your life? It's just not there to the level that it needs to be. And in chiropractic, it's very similar. There's doctors that are out there that are they're adjusting patients, but they're not teaching their patients. They're not teaching them about supplements. They're not teaching them about exercises. They're not teaching them to make different choices so that their bodies can actually function better, and giving them that why behind making those decisions to do it. Because you give somebody, oh, you got to do this ice, and then you got to do these exercises, and they're like, well, how am I going to find the time to do that? So time is all about value in our lives. Everybody's busy. And so, but people find the time to do things they value. And so if you teach, then they'll have the value, then they'll make the good decisions. So that's why I take the time to do these classes. And as many of the classes that I've done and many of the topics that I've done. So with osteoarthritis, I keep hearing these questions and these statements from patients. I said, I need to do a class just kind of to dispel some of these myths and make some understanding, getting some clarity in this. So I kind of just a little general overview. I'm going to talk about osteoporosis first. The early stages of osteoporosis are asymptomatic, right? There's no feeling that the bone is losing some type of calcium or some type of density to it. And it affects the bone itself that is actually being affected, whereas osteoarthritis is affecting some of the bone, but mostly the joint. You have a decrease in bone growth inside the bone. So there are cells within the bone itself that break bone down, and there are cells within bone that repair and build the bone back up. So much like any other cell, like the lining of the stomach is constantly breaking down to release hydrochloric acid so we can digest food. And there are cells that, excuse me, that are there to rebuild and re-strengthen and make a new lining within the stomach and make it healthy and strong again. So there's cells that break it down, cells that repair it. So that process is going on all the time. So what we find out is that the cells that are breaking the bone down are still functioning, but the cells that repair the bone and make it strong again are actually becoming weaker. And I have a slide towards the end that I think is going to make a little bit of sense of some of this, but it's not really being discussed all the time with doctors who are just saying, here's a prescription. So there's not enough healthy movement with osteoporosis early on. So if you go back to people who have osteoporosis, typically it affects women more than men. And we're going to talk about that a little bit. And there's some hormone related issues that make it more common in women as well. But if you go back to even to childhood lifestyle, the more activity the children have as kids, the less likely they are to have osteoporosis as they age. So it's a disease that's related to movement. There's just not enough healthy pressure on the bones, which we'll talk about a little bit more too, to make those bones want to get stronger. Okay. Just like exercising your muscle, makes it stronger, right? Well, the bones get stronger when you exercise as well. So one type, but many causes. So the osteoporosis is a condition, but there's a lot of different things that lead to osteoporosis, and it could be hormone related issues. It could be lack of exercise. That's an issue. And of course, we're becoming a very sedentary society now. So we sit more and everything's getting weaker in our bodies the more that we sit, because we're just not engaging the muscles and the joints and the bones. The cardiovascular system's not working because we're sitting all the time. We're seeing people have heart attacks at younger and younger ages. The lifespan is dropping for us as human beings in the United States. It's not necessarily because older people are dying younger, it's because younger people are dying at a much higher rate than ever before. So we have people in their 40s and 50s are having heart attacks and cancers and diseases that are affecting them that normally would affect more people in a more aged population. And so there's a problem there, right? Our bodies are breaking down much faster, much earlier, much younger on average. So some of the dietary changes, food changes are being blamed on a lot of different levels, and the lack of movement that we have as a population as a whole, because so many people are working on computers. So movement is critical to help build up the bone growth. And osteoarthritis, early stages are, again, there's no symptoms for early degeneration. As with most every disease that we face as human beings, we don't have a symptom. We're conditioned and we're taught, I'm not going to go to the doctor till I'm sick. Yet that's sometimes too late. That means your body's already broken down and it's already reached a level where it's going to be incredibly difficult to reverse that process. Where if we took a little bit better care of ourselves when we're younger, or as a parent, we teach our children now how important exercise is and eating healthy is, then we have that opportunity for them to have a healthier life than we had. But a lot of us are stuck in this rut of being busy and trying to just handle everything in our lives right now. That's not part of an education process at all with our children. Or at least they can't use their parents as examples to see and learn, unless they see mommy and daddy going to the gym, or they see mommy and daddy exercising, and they see mommy and daddy preparing meals together and cooking and trying to eat. It's just not very common anymore. Overgrowth of bone into the joint. So there is some bone growth, but it's off the end of a bone. It'll create these spurs and jagged edges into things. And I have a couple of pictures that'll help us visualize that. And unhealthy joint movement. So we used to think, well, osteoarthritis is mostly because people just work too hard. And I'm going to kind of poke a hole in that theory in a little bit when we talk about it a little bit more. It's really when the joint itself is actually subluxated or out of its normal alignment that causes it to break down so rapidly. And just we talk about, the front end of your car, your tires don't last if it's out of alignment, because then the same thing happens to our joints. If they're out of alignment, they're not going to last. So there's many types of arthritis, but there's usually one underlying cause, and that's inflammation. So osteoarthritis, and here's a picture of a knee, and Ron, this is for you. And it's for a lot of people actually. But this is on the left, we have a picture here of a knee, and you can see the gap in the space in between the bones. That gap is there because cartilage is not as hard as bone. We can't really see the cartilage, but it's creating a beautiful space in between those two bones there. And it makes a sliding and gliding motion, smooth, and there's fluid in there, and it's a very slippery surface. So they should slide and glide all the time. And over time, what you'll start to see is these joints like here, where there's bone literally on bone, And actually there's this whiter area is a big buildup of extra bone the body is putting in there to try and make the joints, somewhat support the bone, because it's being damaged over and over and over again, almost like you would form a callus in the summertime walking barefoot. And you can see the other side is not doing so well either. But if you look at the alignment of the bone, can you see that the top, the femur, is on an angle, and that the tibia is on an angle? So you can even see in this picture, it's out of alignment. And so the alignment is part of what breaks that joint down over time, because it's not proper anymore. And that's what makes it just deteriorate faster and faster and faster. Here's a picture of the spine. I didn't use an x-ray here just to mix it up a little bit, but just to give you some color. And here's where I get to talk about my point. When it comes to the spine, it's going to take a bone that's not in its proper position. And even in this picture that was drawn, you can see that this bone is actually pushed back behind this bone and behind this bone. And so it's pushed back and out of place, right? And what it does is it pushes back into this area where the nerve comes through. And now you have a pinched nerve. And so, but that process takes years of degeneration. And you can see that there's bone on bone here in the front. There's very little disc material left in between that bone anymore. But they did a really great job of drawing the picture up above. And this is what we see the most of the time as doctors. And we'll see this perfectly healthy joint right above a deteriorated joint underneath. And so we'll say, oh, arthritis, that's a disease of aging. And my statement is that both of those discs and both of those joints are the same age. So that can't be true. And very often we'll see perfectly healthy joints right next to a completely obliterated and deteriorated joint. So there's no way that that could be a disease of just aging, because they're both the same age. The question has to be, why does this joint deteriorate so much faster and the above joint is okay? And then we'll say, well, maybe you had an injury. Well, the way the spine is designed, there's no way you could put a force onto that joint that isn't going to affect the joint above or the joint below it. It just can't happen. If there's an injury, there's an injury. They're all going to take some force or some part of that injury, no matter what it is. And so it's always going to come down to the misalignment of that vertebrae that's causing that abnormal wear and tear, and it breaks down and breaks down and breaks down faster than the bones that are in their normal position and can continue to function in a healthy way and are under much less stress. And so that's the key point that I want to make to that. And that's where chiropractic comes in, of course, because that's what we fix. We fix the subluxations. Unfortunately, the majority of our patients are not kids. The majority of my patients are people who already have the degeneration. I've already broken down the joints. So then it puts us into a position of saying, look, I can't fix that anymore. But what I can do is I can offer you some relief by trying to keep healthy motion and healthy movement, which will help to slow down, if not in many cases, stop that degenerative process. And I have patients that have been coming to me for over 20 years that exercise gently, not physical stressful exercise, but they exercise properly. And what they have is no degeneration has accrued in those joints 25 years later. And I have other patients that don't follow the care plans, don't keep up with the maintenance part of the plan. And within 5 years, I can take an x-ray and I can show you another disc level is now broken down, because once the bottom joint stops moving, then the next one's under pressure and the next one's under more pressure, et cetera. So they end up breaking down faster and faster and faster. It becomes a progressive disease. Here's a MRI of the neck, looking at it from a side view, and you can see the disc here is kind of compressed, but you can see some of these bony spurs that have grown out. You can see the spinal cord up in the center. The reason I picked this one out, and I'm sorry that it's a little bit kind of fuzzy, but the reason I brought it up is because the normal curve is completely gone in this person. So it's a completely straight, if not almost a little bit backwards curve here. And that's what's put this joint under so much pressure that caused it to degenerate over time, where the other disc spaces are all healthy. So again, it's not age. No matter how many times somebody will say that, and I try and correct patients and oh, I'm just getting old. Well, there's a couple of spots in you that are aging faster than other spots, and those are the ones that need help, and then you won't feel so old. So treatments. And again, the osteoarthritis classes, if you want more information, please go to the YouTube page and look them up. There's 2 great classes on there with a lot more information than what I'm giving you today, but at least to kind of do this for a comparison standpoint, the osteoarthritis is an incredibly painful condition in the joints, and typically osteoporosis has no pain at all. You don't really feel anything with osteoporosis. You're not going to have achy joints, right? You're not going to have the inflammation. You're not going to have the pinched nerves. You're not going to have the kind of pain that comes with osteoporosis. So osteoporosis, people say, oh, my doctor says I have pain from it. You don't have pain from osteoporosis. That's not what you have. Until you have a fracture or a fall or something breaks, then you have incredible pain, but there's no feeling and no sensation that it's coming or that it's happening. So number 1, back to osteoarthritis for a second, prevention with chiropractic care, rest, exercise, proper diet, very important to eat an anti-inflammatory diet. Once you have it, basically you do the same thing. We do everything we can to prevent it with those things, but those are actually the same treatments. We tweak it a little bit on what you can take as supplements that are necessary to try and control some of the inflammatory process in your body, but it still comes down to having some type of movement in a healthy way. You know, for you guys, the big thing is going to be getting back dancing again. Of course, you know, that's going to be that's your healthy movement that you love to do. And I'm a big fan of that, you know, you guys getting back to that. So we want to make sure we get you back to moving and feeling good enough to move again. The medications and surgeries, you know, they're a last, you know, option in many cases. All come with a cost, not just financial. You know, there's things, you know, your bodies are made and designed to move and function in a certain way. And the minute that we start to alter that by taking pieces and parts out, you know, obviously it can't ever be the same again. So a lot of times surgeries put stresses on other things in other places, but that you're changing the body. So there's not always great outcomes. There are many, but they're not always. And so with medications, you know, medications are many times something that we can use to relieve some of the symptomatology, but over time, if you keep taking the medication, then we start having side effects of medications. All medications have side effects, or they wouldn't be a medication, right? You wouldn't have to go to the doctor to take it if there wasn't a chance it was going to hurt you. So the doctor has to overview this stuff. It's not safe. It's not candy. You know, well, candy's not that safe either, actually, with all the sugar. But but really, there's always a thing. So really, we want to start with the least invasive procedure first, and that is definitely chiropractic care, exercise, proper rest, proper diet, and it's all got to be proper. So there's all kinds of, you know, things that you can't do when you have arthritis when it comes to exercise, and shouldn't be eating when you have arthritis as well. So this is osteoporosis. So this graph kind of shows what I alluded to earlier. So you can see in men, we right around between 20 we peak, and then right around 50 we start to decline. It's relatively the same in women, but we tend to see a bigger drop off in women. Women never really get the bone density that men have based on testosterone and estrogen levels in our body. But once that estrogen fades away in women, it also drops off much faster than testosterone does in men. And so we have this bigger drop off in how the bone holds on to calcium, and the strength in the bone itself is definitely affected. So it's a bigger issue in women than in men. It doesn't mean it doesn't occur. That you still hear about men falling and breaking a hip as we get older, but it's far more common in women. So this is the little picture. If you look over here on the left, you can see a good healthy matrix within the bone. And on the right, you can see these giant holes and pockets where there's nowhere near as much of a dense matrix as there is on the left, picture on the left. And we all lose, you know, some of this bone density naturally over time, and there isn't a lot we can do about that, but we want it to be natural. We want it to be within a normal range of bone loss that we have, so our bodies are still strong. And like I mentioned earlier, one of the key components is exercise. And I'll talk to you about some supplements and stuff that can be a huge help with this. and a big, I think, misunderstanding that's occurring right now with one of the most popular forms of treatment for it. So the matrix is the key. Keep making this sure that's good and strong on the inside, not these holes here, okay? And when it comes to the medications, one of the issues is with the types of medications, what they tend to do is they build up a hard, this white part on the outside, outer shell. So they're strengthening the bones, but they're only strengthening really the bone on the outside. It doesn't really affect the matrix on the inside. So what happens is that over time, what we're seeing that patients who stay on these medications for around 3 to 5 years or more, which is a lot, start to have more symptoms and bigger problems. So meaning that if you were to fall and break your hip, typically you're going to have a fracture that's going to go across. The most common is what's called the neck of the femur. They call this the head, and then the neck, and then the body is the rest of it. But this neck here is where there is a lot of pressure when we fall, and it can create damage. Well, what'll happen is you'll get a line, and then the doctors can go in if they need to. They may just leave it and let it heal on its own, or they may go in and do a procedure that's going to put a screw through there, a rod through there to strengthen it back up again in the hopes that it's going to heal and become stronger. But with medications, what happens is that because it's a hard outer shell, the best way to explain it is just like an egg. So if you've ever gone to crack an egg, it very rarely are you going to get a straight line across that's going to crack that egg open. The most of the time, if you tap it or hit it, you're going to have multiple cracks all over that egg. And when you have these multiple cracks, they call them eggshell fractures. So they literally just crumble. Now there's no way to put it back together again because it's just mush inside. And so the medications do make it stronger, but they also oftentimes can come at a very big cost, like I mentioned before. So I'll get into some of the treatments. Already starting to talk about it. We talked about prevention. Chiropractic care helps with osteoporosis indirectly, so to speak, because what it does is it gives you the ability to feel better with if there's joint problems or nerve problems or things like that that are slowing you down, which gives you the opportunity to then exercise, and we can get you back moving again. And proper diet, like I mentioned before, and rest. So once you have it, again, same thing, same as above. You got to go back and do all the same things. We have to go at a different level of intensity to try and strengthen. Medications, come with short-term possible results and long-term potential damage for your body because of the fractures that I just explained. You want a good quality calcium, number one. And we have a lot to talk about calcium before we can finish this conversation when it comes to osteoporosis. You need a great quality, so we'll spend some more time on that, but the D3 has to be something we have to look at across the United States. We are in what many are calling an epidemic level of low D3 and low magnesium levels. And the low magnesium levels, we're seeing all these anxiety issues that are going through the roof and so on and so forth. The way we're farming, the fruits and vegetables and foods that we eat don't have anywhere near the level of magnesium that we used to have in our diets. So the two things that I think are probably some of the most crucial things to supplement with is D3, and it's got to be a good quality D3. It can't be junk, and it's got to be magnesium. And so those, and it's just critically important. If you do have or are dealing with osteoporosis and you're outside of the normal range with osteoporosis, then you're going to also need to supplement with some K2 with the D3, because all three of them together, you can't get calcium into the bone without D3. So it attaches to it, it binds to it, and it takes it into the bone. You can take all the calcium you want, it's never going to get into the bone unless your D3 levels in a proper level. And what the D3 levels have been so bad that, and I've got another YouTube class about that, by the way, that's on the page, the sunshine vitamin, we call it. The D3 levels have gotten so bad that they, instead of saying, hey, we've got an epidemic and a problem on our hands, and D3 is critical to our immune function and cancer and heart disease and all brain function, and just about everything under the sun requires this vitamin. We used to just think that's all we needed was for healthy bones, but that's not true. We realize how big a nutrient this thing is now. So You've got to, they just went ahead and lowered the normal. So, well, this is not, so now we have normal, and then we have low normal, and then we have low. So doctors really aren't even addressing it when it's in a low normal level. And we already know that it's a major problem. And studies and research are out there saying your cancer levels of breast cancer, colon cancer, et cetera, are so much higher in people who have these low D3 levels. And we're already starting to see a causal relationship that we've got to get these levels up into the normal range. And that, there should be between 50 and 70. And, very, very, very rarely am I seeing anyone ever near 70, unless they're supplementing and getting the proper nutrition. We're just not getting out in the sun. And when we do get in the sun, we're covered up in lotion that blocks the ability for our bodies to even produce it anymore. So let's talk about the calcium a little bit. So I think everybody hears from their doctor, or anybody, talking to each other or online or the news or anything. He's going to say, oh, you need calcium if you have osteoporosis. And yes, calcium is the building block of that matrix inside of the bone. But number one, it's not going to go into that bone unless you have the D3. Number two, it's not going to go into that bone unless you're doing some type of exercise that is stressing the bone to want to grow again and strengthen. So if you're not up and you're not moving around, your body's not going to want to absorb the calcium because you're not putting any stress on it to make it stronger. Like I used the example before, like if you're not using your muscles, what happens to them? They shrink. Our bodies are always adapting to whatever we're putting them, whatever environment we put them in. So, and they say, well, I'm getting older, so I can't exercise. That's not true. Those research studies have proved there's 90-year-olds going to the gym, 90-year-olds grow muscle. Does it happen as fast as when you were 20? No. But it still happens. Your body doesn't ever stop trying to adapt to the environment ever until the day you die. And so it's critical that there's some form of activity. So calcium and magnesium. Now I talked about magnesium a little bit before, and the reason is because we are in a vastly out of balance system in our body. So everybody's like, well, you need to have calcium. Well, now all this research is coming out and saying, well, you know what? You get calcium from almost everything that you eat has calcium in it. And then we're supplementing with a whole bunch more calcium. And what we're doing is we're over calcium aiding. That's a Dr. Bob line. Our bodies. So when this calcium magnesium get out of balance, what calcium does is calcium is like a stimulator to our nervous system and muscle tissue and cells in our body. So everything gets more tense, everything gets more excitable with the nerves, and this is what happens. And you can see the picture on the left. It says unhealthy cell. You can see all the C's. That's all the calcium inside the cell. And you can see this is a magnesium deficiency, whereas on the left is a healthy cell with all the magnesium and just a little bit of calcium. That's the way it should look in our bodies. So not only are we getting a deficiency of magnesium in our body because we're just not getting enough of it, but then we start throwing a whole bunch of calcium into our system, and now we throw the whole balance out of whack in our system. So we need actually more magnesium than ever before, and we're getting less. And so this imbalance creates this out of balance structure within every single cell of our bodies, and especially the cells of bone. So unless you have enough magnesium, you can't build up a strong enough level of healthy cells in order to be able to affect this. Now I say it because we're talking about osteoporosis, but this is every single cell in your body. Your kidneys especially are the ones that seem to be the most sensitive to magnesium, and your vascular system. So we see all these people, so many people are having anxiety issues because their nerves are firing at such a fast rate because they're out of balance with too much calcium and not enough magnesium. We see people whose heart are arrhythmias and all these heart problems and all this, the linings and what it has to do with affecting the healing process within the vascular system. So magnesium is really one of the key players in all of this process. So this is a really critical thing I want to get through to you. We need nowhere near the level of calcium that we are have recommended to our patients, because number one, if you're not doing the exercise, that calcium is floating around in your system and it's just going into other cells or maybe turning into a kidney stone somewhere, but it's definitely not doing anything to help your body. What we need to have is that healthy balance between the calcium and the magnesium. And of course, we get calcium from all kinds of green vegetables and dairy products. It's, I mean, just it's a staple of whether you're a vegetarian or not. It's the staple of a lot of our foods that we eat. So it's coming from a lot of different sources. And I wanted to throw this up, and I know we're not necessarily talking about magnesium, but I think it's critical that we understand this, that magnesium deficiency, you can see all the symptoms on the left: irritability, anxiety, lethargy, fatigue, memory problems, anorexia, loss of appetite, nausea, vomiting, seizures, muscle weakness, muscle cramps, tremors, vertigo, difficulty swallowing, irregular heartbeat, as I mentioned before. Some of the more clinical names of some of these symptoms come out as depression, dementia, chronic fatigue syndrome, ADHD, asthma, colon cancer, epilepsy. These are all everything on this whole right side: migraines, PMS issues, chest pain, angina, cardiac arrhythmia, as I mentioned before, is a really common symptom of having a decreased level of magnesium. Hypertension, high blood pressure is another one. And type 2 diabetes is hugely related to it, because of the calcium magnesium imbalances within the cells start to make them not be able to function with and around sugar, and that's part of the issue as well. So magnesium is a critical supplement when it comes to this disease. Having a proper balance of magnesium and calcium is good. And most of us have way too much calcium in our bodies to begin with, the way our society is designed, in the foods that we eat and the things that we're missing, like magnesium. So that balance is critical. The D3, the K2 are important, but ultimately, bottom line, you have to move in order to even have the bone ask for more calcium. So what I'm going to do, I love this quote to Thomas Edison here, is: the doctor of the future will give no medication, but will interest his patients in the care of the human frame, diet, and in the cause of prevention of disease. As a society, we're more apt to make sure that we change our oil in our car, because we don't want the engine to blow up. We take care of things in our home. We try and prevent things from breaking down and problems. We do maintenance on things that are things, but we don't do maintenance on our body. And we don't really talk about prevention. And what we've gotten into an age now where people are so sick, and diseases of things of like diabetes, the number of children with diabetes doubled during COVID. Children with type 2 diabetes. And I remember it when I was a kid, type 2 diabetes was not a disease of children. Type 2 diabetes was something somebody really old got, right? Grandma, maybe, but it wasn't a disease of younger people. And now we're talking about, during COVID, the number of type 2 diabetes in children doubled. Why? Because they got no exercise, because they were trapped in a house. They didn't necessarily eat healthy while they were in there. And that was basically it. They got a ton of sugar in their diet. They got no exercise at all. The obesity rate went up in the last year and a half during COVID. That's the last thing we needed as a nation. The number of people who are dying from COVID is mostly people who are obese. The only children that are being affected by COVID are children who are morbidly obese. There is a connection between having a healthy, functioning body and the inflammation that comes along with obesity. And when you're already obese and inflamed, you put yourself in a critical place when it comes to these type of viruses that are affecting us right now. And I wish from the beginning, for all the doctors would have gotten together and said, look, this is a horrible virus that we're facing right now, but there is something you could do about it. You can exercise, and now is the most important time ever to eat healthy. And instead of making that like a unified conversation, only the emergency room doctors were noticing this, and they're the ones that were saying it. But the regular doctors were just not making any connection to it, it seemed like, or at least not saying anything about it or teaching their patients about it. And I've been beating this drum since day one, because it was obvious from all the research right from the very beginning who was being affected by it. We need a healthy immune system, but the only way to do that is to be able to put the right foods in. And you don't have to never eat a pizza again in order to be healthy, or never have ice cream ever again in order to be healthy. You just need to mostly eat healthy, and you need to move. So of course, chiropractic care we help you with that. We'll teach you about this stuff, but ultimately, this is where we want to go. We've got to focus on prevention. We got to help our children understand that there's a better way to live. We have to have our children's children learn that there's exercise, how critical exercise is. We've got to get this message out, because there will be another virus like this, or there's going to be another mutation of this, because it's a virus, and that's what it does. It mutates. It's going to change. There's going to be a D. We're going to run out of Greek letters before long, because it's just a virus. Like the flu virus is different every year. That's not the same. It's something different, because it mutated. Our immune systems figured out how to kill it, and that's the end of it. That's the end of it. Now it's got to mutate in order to stay alive. And that's what viruses want to stay alive. So do we. So we need to make the proper changes in order to make that happen. So I hope this clears up some of the questions that people have had with osteoarthritis and osteoporosis.
Thank you for watching our video. If you like what you saw, be sure to subscribe to our channel.
Yeah, and like us on Facebook. There's always a lot of information also on our website at rosemontchiropractic.com.